Hi, I'm Stina Stephen from Tiju's Academy. I bring you today few terms that can be quite confusing, like homonyms, heteronyms, and homophones. So let's explore the difference between these terms. Let's start with homonyms. Homo means same and nyms are names. So homonyms are having same spelling, same pronunciation but different meaning. So let us look at few simple examples first. We have here close. The chair was close to the door, so the door didn't close. They both have different meaning, but they have the same spelling and same pronunciation. So if we look here, the chair was close to the door. This close means near, near to the door. So this is close. And then later, so the door didn't close. This close means the opposite of open. Okay, let's look at some other examples. Bat. This could be a sports bat or it could be the mammal bat. Bark. It could be a dog's bark or it could be bark of a tree. Match. Match could be a matchstick which you can light or it could be a match that is a game. Similar to that is present. Present, as you know, you can give, present the sermon, or it could be a gift. You could present the present. So these two terms have the same pronunciation and spelling but different meaning. So let's see some OET related homonyms. Let's start with the first one, cervical. We are very familiar with the word cervical, which is a region of the neck. So we have the cervical vertebrae. But the other term would be the lowermost part of the uterus. It's also known as the cervix. So when we talk about cervical cancer, that would be related to the uterine cancer. It's not related to the neck. So the next word would be dermatome. It is a region of the skin which is supplied by specific nerve roots. It's also an instrument which we use to peel off a thin layer of skin that can be used for skin grafting. So now we have the term heteronym. Like I mentioned earlier, homo means same, so hetero would be different. In this, we have the same spelling but different pronunciation and different meaning. Let's look at some examples. First, we have the nurse wound the bandage around the wound. This is wound, which means to go around, and this is wound, which is an injury. So let me repeat that. The nurse wound the bandage around the wound. Some other examples are wind or wind. You can wind the clock and the wind gives us pleasure. For example, the patient had a ligament tear, so he shed a tear. So you can see that it has the same spelling but different pronunciation and different meaning. So you can tear a paper, you can tear a cloth, but you can shed a tear. The next word would be bow or bow. So we can make a bow, but we take a bow. The next term we have is homophones. These have different spelling, same pronunciation and different meaning. So I have selected few OET related terms which would help you. Anuresis, anuresis. As you can see, they pronounce the same, but they have different spelling and a different meaning. Anuresis here means lack of urine, whereas here it means urine incontinence or bedwetting. The next word would be ileum and ileum. You very well know ileum is the last part of the small intestine. For example, the doctor performed anastomosis with the ileum and colon, whereas this ileum pertains to the pelvic bone. Let's look at the next word, vesicle and vesicle. This vesicle pertains to the bladder. So if we say, for example, the patient had vesical pain during urination, and this vesicle is a small blister or sac. So we could say the patient had a vesicle which was filled with clear fluid. Let's look at the next term. This is very well known to us. Mucus and mucus. They are both pronounced the same, but the meaning is different. We have mucous membrane or mucus lining, which secretes mucus. I hope this video was useful. For more informative videos, follow Tiju's Academy.